Good evening and thanks for joining us. Across the country, this is a heart-wrenching time for families with loved ones in long-term care homes. Residents have been dying in their beds. Their family members are banned from visiting. In many homes, there are not enough staff to take care of everyone. And all loved ones can do is anxiously wait for word on where the next outbreak will be.
The sad truth is, our long-term care homes are quickly turning into the front line of the fight against this virus. And my top priority right now is getting the troops and the resources needed to this front.
About half the deaths from COVID-19 in Canada are in long-term care homes. The outbreaks are worst in Ontario and Quebec, where more than 400 facilities have detected the virus. These are just some of the homes. In each of them, at least 20 or more people have died of COVID-19. Ontario's premier says the virus is tearing through care homes like a wildfire. He vows to do what it takes to save lives, including putting hospital teams into infected care homes and doing more screening and testing of staff. And he's following the lead of BC and Alberta, banning care home staff from working at more than one facility. We'll have more on the political response in just a moment. But first, Mike Armstrong on how the coronavirus is ravaging Canada's care homes, including one that's under criminal investigation.
With every day that passes, new nightmare stories trickle out of this seniors' residence. One of the latest from March 29th. A doctor from the local health authority couldn't reach anyone on the phone, so she went in person. Dr. Nadine Larente says she found 130 residents being cared for by 2 orderlies and a single nurse. Desperate, the doctor called her 3 teenagers and her husband for help feeding the residents. Quebec's premier Tuesday thanked Dr. Larente and her family for their humanity, he said, on behalf of the entire province. Now, according to documents obtained by Global News from the residence's owners, the facility had a sick nurse on duty showing symptoms in the days before people started dying. On the 29th, according to the documents, when the facility was placed under trusteeship by the local health authority, only 3 patients had died. In the 2 weeks since, even under trusteeship, they've lost 29 more. As recently as Monday night, new positive tests for COVID-19 were still coming back. Now, the facility has had issues in the past. A coroner's report into a resident's death last year questioned the training of the staff. The company that runs the facility says it provides adequate care as confirmed by the most recent March 2019 government inspection. The company says public health officials created a catastrophic situation when they took over, failing to isolate infected patients and failing to properly treat and medicate others. But what's becoming increasingly clear is that even in normal times, it is demanding and difficult work for employees at care homes to meet the needs of residents. The COVID-19 pandemic is a breaking point. Close to 300 facilities in Quebec are struggling with COVID cases. About 10 kilometers away, this residence has had 26 deaths. Just north of that, another institution has lost 33 residents. Among them, Solange Arsenault. She was 70 years old. Her wife, Anne Kettenbale, calls the situation in residences immoral.
This is not something that just happened by accident. They were never among the institutions that were going to get the resources.
Kettenbale says hospitals were prioritized at the outset of this crisis, and rightly so. But now governments have to pivot. Hospitals aren't as overwhelmed as predicted, while hundreds of seniors' residences across Canada are. They need help.
It has to happen yesterday. It has to happen now.
Whether they have cases or not, seniors' residences are locked tight. That doesn't only go for visitors, but at times information as well. This Toronto facility has had 25 residents die.
So I went for 3 weeks thinking my father was fine. He's not. He's dead.
The biggest challenge is staffing. Employees are staying away because they're sick or fear getting sick. Quebec is asking anyone with experience in healthcare to come forward, and it's talking to Ottawa about using soldiers in seniors' residences.
Yeah, we're asking them how many people with the expertise in health care can be sent to us.
What has become clear in this crisis is society's most vulnerable people were being housed in society's most vulnerable institutions. Mike Armstrong, Global News, Montreal.
As Mike said, working in a care home isn't easy. It involves deeply personal tasks like feeding, dressing, and personal hygiene for the residents. Those who do that work get low pay and often work part-time in several homes to make ends meet. Canada's health minister says it is obvious now that has to change.
We tend to devalue the work of caring for people. And I think this is an opportunity for Canada to actually think a little bit more about how we will move forward with a stronger system of care for people who are aging. Because in fact, all of us in this room are going to end up there. And these are our mothers and our fathers and our grandparents and our aunts and uncles.
In the short term, though, lives need to be saved right now. David Akin is looking at what measures are being looked at and which provinces are getting it right. David?
Well, Donna, for most of this crisis, the fear was that hospitals would be overwhelmed. And in fact, it is long-term care facilities across the country that are facing the most stress.
Despite our best efforts, we're dealing with a wildfire at our long-term care homes right now.
And just as in Quebec, Ontario is desperate to find more firefighters, the nurses and personal support workers who can help take care of seniors. To that end, the Ontario Premier vowed to redeploy teams of hospital workers to long-term care facilities.
We'll spare no expense to protect our most vulnerable. We must redeploy every available resources to our long-term care homes right now.
Ontario, like Quebec, is also looking to boost the pay for part-time workers looking after seniors. And then there's the rules, the protocols that operators of long-term care facilities must abide by. Those rules are set by the provinces.
I would say that every province and territory really sees with, doing best practices.
So far, at least, the federal role has been one of coordination and information sharing.
Seniors' residences are provincially mandated, but the federal government has put forward guidelines for across the country on making sure that our seniors are protected.
Those just updated guidelines incorporate current practice in some provinces. British Columbia's decision last month, for example, prohibiting caregivers from working in more than one long-term care facility. Ontario's premier said a similar rule would go into effect in that province overnight.
I will say that there are some people getting it right, and it's slow, but it's coming.
And those improvements cannot come soon enough for Quebec and Ontario. The premiers of both those provinces today saying that the health and protection of seniors in long-term care facilities is now their top public health priority, and it's a concern right across the country, Donna.
It sure is. And David, I want to ask you about something else. An open letter is circulating, signed by politicians and academics from around the world, including a former Canadian Justice Minister, Irwin Cotler. It says the pandemic has been caused by China, and it calls it that country's Chernobyl moment. The letter says we should never forget that China's Chernobyl moment was a self-inflicted wound. The CCP silenced Chinese doctors who wanted to warn other health professionals during the early stage of the outbreak. David, it also criticizes the World Health Organization, claiming that it bowed to Chinese pressure to downplay the severity of the situation. Have any Canadians besides Irwin Cotler signed it?
Well, Irwin Cotler was certainly the most prominent name on that list, the former federal justice minister, longtime human rights activist. But there were some other Canadians there as well, authors, commentators, academics. And this group has really been trying to sound the alarm about China for some time. But the Canadian government not ready to join in on that criticism. Deputy Prime Minister Chrystia Freeland noting that the World Health Organization gets its information from a variety of sources. She also had some classified intelligence that she couldn't talk to us about. But there might be one more reason here, and that's this. China right now is a vital source of the ventilators and masks that Canada urgently needs. Donna?
All right. David Akin in Ottawa, thanks.
The new series that goes inside the COVID-19 pandemic from the front lines.
We're still in a very critical stage of Canada's COVID-19 epidemic.
To the everyday heroes helping us cope with the unprecedented change.
We want to help because there's a desperate need.
We shouldn't fend for ourselves. We have to all come together and help each other out.
Coronavirus, the new reality. A Global News special, Sundays at 7 on Global.